Weakened vein valves can lead to a condition called venous insufficiency, causing symptoms like swelling, pain, and fatigue in the legs. But fear not, there are plenty of steps you can take to support your vein health and keep your legs feeling strong and vibrant. Are you tired of dealing with leg pain, swelling, and discomfort? It's time to take control of your vein health and unlock the secrets to strong, healthy legs. There are simple yet powerful strategies to strengthen your veins, improve circulation, and keep your legs feeling energized and vibrant. Say goodbye to leg woes and hello to a life of comfort and vitality. This is an issue that affects millions of people worldwide: vein health and circulation. Let's first take a look at some of the reasons that can cause weakened or failed vein valves. Age, genetics, prolonged standing or sitting, obesity, pregnancy, deep vein thrombosis, DVT, lack of exercise, smoking, high blood pressure, previous leg injury or surgery, chronic venous insufficiency, CVI, hormonal changes, and other medical conditions can all contribute to venous insufficiency and valve failure. 1. Age. As people age, their vein walls can weaken, which can lead to valve incompetence. 2. Genetics. Some individuals may inherit a predisposition to weaker vein walls or faulty valves, increasing their risk of venous insufficiency. 3. Prolonged standing or sitting. Jobs or lifestyles that involve prolonged periods of standing or sitting can put increased pressure on the veins in the legs, leading to valve dysfunction over time. 4. Obesity. Excess weight puts additional strain on the veins, which can contribute to valve weakness and venous insufficiency. 5. Pregnancy. During pregnancy, hormonal changes and increased blood volume can put pressure on the veins in the legs, leading to valve incompetence. 6. Deep vein thrombosis, DVT. A blood clot in the deep veins of the legs can damage valves and impair their function, leading to chronic venous insufficiency. 7. Lack of exercise. Regular physical activity helps maintain healthy circulation and strengthens the muscles that support vein function. Lack of exercise can contribute to venous insufficiency. 8. Smoking. Smoking can damage blood vessels and impair circulation, which can contribute to the weakening of vein walls and valves. 9. High blood pressure. Hypertension can increase the pressure within the veins, potentially leading to valve incompetence over time. 10. Previous leg injury or surgery. Trauma or surgical procedures on the legs can damage veins and valves, increasing the risk of venous insufficiency. 11. Chronic venous insufficiency, CVI. Untreated or poorly managed, CVI can lead to progressive damage to vein walls and valves, exacerbating the problem over time. 12. Hormonal changes. Hormonal fluctuations, such as those associated with puberty, menopause, or hormone replacement therapy, can affect vein health and contribute to valve dysfunction. 13. Other medical conditions. Certain medical conditions, such as varicose veins, peripheral artery disease, or connective tissue disorders, can increase the risk of venous insufficiency and valve failure. 14. Medications. Some medications, such as hormonal contraceptives or certain blood pressure medications, may increase the risk of venous insufficiency as a side effect. 15. Chronic inflammation. Conditions associated with chronic inflammation, such as autoimmune diseases or chronic infections, can damage blood vessels and impair vein function over time. Now let's take a look at some of the steps we can take to strengthen these vein valves. But before I do that, I'd like to take a moment to ask for your support. It will only take a few seconds of your time and will cost you nothing. Now, because I know that you are finding this video informative so far, and will continue to find value in the information that will be provided in the rest of this video, please click on that thumbs up button. It's a simple act, but the impact can be massive. Imagine that simple click as a ripple in a pond, extending outwards to touch and influence others to become more conscious about becoming more informed about their health and well-being. It also helps to spread much-needed important information to a wider audience, which can potentially make a change in someone's life. So go ahead, show your appreciation for these types of informative videos. Click that thumbs up button to potentially make a change. Now, to ensure that you don't miss out on any more valuable content, click the subscribe button and the notification bell that is beside it, then select all to gain access to all the other videos on my channel and to stay up to date with any new ones that gets posted. Most importantly, subscribing is absolutely free. My channel isn't just about sharing, it's about building a community of knowledge seekers who understand the importance of staying informed and updated when it comes to a healthy lifestyle. Here, you'll find a treasure trove of information on how to live a healthy lifestyle, including delicious, nutrient-packed recipes and tips on how to interpret the signs your body sends you when something's off balance. Subscribing and commenting not only helps the growth of my channel, but also enriches this platform by making it more interactive. Whether it's a question, a suggestion, or a simple greeting, your comments add to the dialogue. So go ahead to click that subscribe button and become a part of this knowledge-packed community. By the way, if you watch this video on your television, you can use your mobile phone or your computer to complete these tasks. Also, do not forget to leave a comment. It could be as simple as saying hi or where you are watching from. I would love to hear from you. Keep watching to find out some of the steps that you can take to repair and strengthen weak vein valves. And now, let's take a look at some of the steps you can take to repair and strengthen weak vein valves. While it's not possible to repair damaged valves completely, there are several strategies that can help strengthen vein walls and improve circulation, which may alleviate symptoms and slow down the progression of venous insufficiency. Here's a list of ways to strengthen and support vein health. Regular exercise. Engaging in activities like walking, jogging, or swimming helps pump blood back to the heart, strengthening the muscles that support vein function. Leg elevation. Elevating your legs above heart level for short periods throughout the day helps reduce swelling and promotes better circulation. Compression therapy. Compression socks or stockings provide gentle pressure to support vein walls and improve blood flow, reducing discomfort and fatigue. Healthy diet. A diet rich in fruits, vegetables, and lean proteins supports overall cardiovascular health and reduces the risk of conditions that contribute to vein problems. Weight management. Excess weight puts extra strain on your veins, so keeping your weight in check can reduce the risk of venous insufficiency. Avoid prolonged sitting or standing. Taking regular breaks to move around and avoiding prolonged periods of sitting or standing can help prevent blood from pooling in the legs and alleviate pressure on the veins. Leg muscle exercises. Performing specific exercises to strengthen the muscles in the legs, particularly the calf muscles, can help improve circulation and support vein function. Hydration. Staying well hydrated can help maintain healthy blood viscosity and improve circulation, reducing the risk of blood clots and supporting overall vein health. Quit smoking. Quitting smoking can improve blood vessel health and circulation, reducing the risk of venous insufficiency and its associated complications. Manage chronic conditions. Proper management of underlying medical conditions such as high blood pressure, diabetes, and lipid disorders can help reduce the risk of vascular damage and support overall cardiovascular health. Avoid tight clothing. Wearing tight clothing, especially around the waist, groin, or thighs, can restrict blood flow and increase pressure on the veins, potentially worsening symptoms of venous insufficiency. Elevate legs during sleep. Elevating the legs slightly while sleeping can help improve blood flow and reduce swelling, promoting better venous circulation. Topical treatments. Some topical creams or ointments containing ingredients like horse chestnut extract or witch hazel may help alleviate symptoms of venous insufficiency such as pain and swelling. Medical interventions. In severe cases of venous insufficiency, medical interventions such as endovenous laser treatment, EVLT, sclerotherapy, or surgical procedures may be recommended to repair or remove damaged veins and improve circulation. Valvuloplasty is one of the most common surgical methods of valve repair. This is a procedure where a surgeon uses stitches to repair the valves. Each of these steps offers a unique approach to improve vein health and combat venous insufficiency. Remember, it's always best to consult with a healthcare provider before starting any new routine or treatment. Stay tuned for our final segment where we'll wrap up our discussion. The information that I have provided in this video will enable you to make an informed decision in the journey to improve your vein health. But it's crucial to remember that every individual's situation is unique, and what works for one may not necessarily work for all. As such, our next step is to consult with healthcare professionals for personalized advice and treatment options tailored to your specific needs. Medical professionals can provide comprehensive assessments of your vein health, taking into account factors such as your medical history, lifestyle, and other health conditions you may have. They can help guide you in adopting the most beneficial habits and treatments from the plethora of options I've discussed earlier. For instance, they can provide recommendations on the type and intensity of exercises that would be most effective for you, the best dietary choices to make based on your personal needs, and even guide you on the right type of compression therapy suitable for your condition. In some cases, they may also suggest medical interventions like endovenous laser treatment, sclerotherapy, or even surgical procedures to help improve your vein health. Remember, incorporating these habits into your daily routine can make a world of difference for your vein health and overall well-being. Small changes can lead to big improvements, so take that step today to consult with a healthcare professional and embark on your personalized journey to better vein health. Stay tuned as we wrap up this discussion in the next segment. Thank you for investing your time in understanding the importance of vein health. Your interest and commitment to health and wellness are commendable. Don't forget, your thoughts, experiences, and comments are vital for me and the community, so feel free to share them in the comment section below. Sharing this video with your loved ones could be the first step in their health journey, so don't hesitate to spread the knowledge. Remember, staying informed is the cornerstone of a healthier, happier life. But it's important to note that the information shared in this video is meant to be educational and informational, not to replace professional medical advice, diagnosis, or treatment. Each of us has unique dietary needs and health conditions, and before making significant lifestyle or diet changes, it's critical to consult with a healthcare professional or a registered dietitian. Especially if you're dealing with underlying health conditions. Your health is your biggest asset, and making informed decisions under the guidance of professionals is crucial. Remember, health solutions aren't one size fits all. What works for one person may not work for another. Therefore, use this information as a starting point and work closely with your healthcare provider to make the best decisions for your health. Thank you for tuning in. Remember, every step you take today brings you closer to a healthier tomorrow. And don't forget to stay tuned for my next video. Until then, stay healthy, stay happy, and never stop learning.